Hey, Shawna, do you think it is possible that what is going on in our personal life could have some effect on what's going on with our health and wellness?
Well, our guest today, Dr. Sarah Vadeboncoeur, certainly thinks so. We have an excellent conversation coming up next.
And before we dive in, I want to give a shout out to our Girls Talk Healthy Aging listener, Miss Tanya Mizko. Thanks for your support. Let's dive in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey. Dr. Sarah, we are so happy to have you on our podcast.
Thank you. I'm excited to be here.
So let's clear up a few things right at the start, and that would be the difference between a naturopathic doctor, an MD, a naturopath. There seems to be a lot of confusion around nomenclature. Can you help us understand?
Yeah, absolutely. So medical doctors are doctors that are trained in more conventional medicine, right? So they're generally going to be the go-to expert if you have a disease, right? If I break my arm, you better believe I'm going to go to the hospital because I want a surgeon and drugs and, good medical care. So they are really good at diagnosing and managing diseases. And generally, the two tools that they're going to rely on are mostly drugs and surgery, which again are very helpful when you need those. What naturopathic doctors do is they have similar medical training. So we've learned about anatomy and physiology and all of the different things that you would learn in medical school. But we're trained to, number one, I think, look at the body in a more holistic way. So I don't know what it's like where you live, but where I live, when I go to the doctor, there's literally a sign on the wall that says, please only talk to me about one problem, which is great if you're just treating one thing at a time. But most of us who live in a body understand that your arm is not separate from your brain, is not separate from your uterus, right? All of these body parts are connected. So one of the tenets of naturopathic medicine is that we're looking at the body in a more holistic way, whereas if a patient comes in, and this just happened shortly before we started recording this, I had a patient who was having fatigue, joint pain, and heavy periods. In our medical system, some doctors might look at those as three separate conditions, where I'm trying to see, are there kind of dots that might connect this, and are these things maybe related? Sometimes they are, sometimes they're not. So how we look at things, I think, is a little bit different. And then how we treat things can also be different. So depending on where you live, where I live, I can't prescribe most pharmaceutical drugs. In some states, some naturopathic doctors can prescribe a whole bunch of pharmaceutical drugs. So we're not anti-drug. I think that's important to say. I think there's often this assumption or this idea that naturopathic doctors are anti-drug or anti-vaccine. And I know, again, everyone is going to have their own opinions, but certainly that's not true for me or the vast majority of my colleagues. But we, in addition to either prescribing medications or sending patients to their doctors for medications, we're looking at other pieces of the puzzle. We have lots of training in nutrition, so we're making sure that people are eating in a way that supports their goals. We are experts in using supplementation and natural health products. Some of us are trained in acupuncture. And a lot of what I do is really looking at lifestyle. I want to know, are you moving? How are you managing your stress? What does your relationship look like? Do you hate your job? Because these are things that most medical doctors don't really have the time to ask about, but that we all know have a huge impact on our health and our well-being. So we have the luxury of more time to ask a lot of questions, to really get to know our patients, and to often offer a more holistic perspective. Because the other thing is, when we look at medicine, everything is siloed, right? If you have a menstrual problem, you're going to get referred to a gynecologist. But what if you also have high blood pressure and rheumatoid arthritis? Now you've got three different specialists who usually do not talk to each other, managing these three things separately. So I think what a lot of my patients love is that I'm the person who kind of keeps an eye on all the things. Obviously, I'm not a rheumatologist. I don't replace any of these things, but I often become almost like a home base where they can come and have someone who knows them well and who knows all the different pieces of the puzzle. And then the last thing to be aware of is, again, depending on where you live, naturopathic doctors might not be regulated. So if you live in Canada, there are several provinces, including Quebec, where naturopathic medicine is not regulated, meaning anyone could hang a shingle and write naturopath and start giving medical advice, where they might have very little, if no medical training whatsoever. So you ideally, if you're looking for a naturopathic doctor, look up the state or the province you're in. There will usually be a professional association, and you can check to see that the person you're seeing has credentials and education and ideally is regulated. And that just helps to keep people from getting, helps them to get good medical advice.
That's so important. So, is there a difference between a naturopathic doctor and a naturopath?
Yes, there can be. So, a naturopathic doctor, you can only call yourself a naturopathic doctor if you live in a place where that is a regulated health profession. So, just like if you want to become a doctor or a physio or a nurse, you have to do certain training, you have to write certain exams, you have to have insurance, you have to do continuing education. In some provinces and states, naturopathic doctors are regulated in the same way that other professionals are. People who call themselves naturopaths, they might just prefer that title, but sometimes that is because they do not have the regulation and they don't have the training. Naturopath is not always a regulated word, meaning it's in some places anyone can call themselves that. And that's where you really need to be a savvy consumer to make sure that what you're getting is actually someone who is regulated.
It
Would it
sounds
be
similar to the training industry that we,
Yeah,
there's no
exactly.
regulation.
Yes.
There's no regulation with
That's right.
trainers. So you just don't always know what you're getting. So Sarah, when you decided to go this route, can you tell us, like, walk us back through what made you get into this? How did you come to this?
I was always interested in health, so I can literally have a memory of sitting down at my grandmother's dining room table when I was probably 7 or 8, and my grandmother had trained as a nurse, and she gave me one of her old, like, anatomy books, so I was just into this from a very young age. I think, like a lot of people, I thought I'm gonna go to medical school, and so I went to university and studied health sciences and thought for sure I wanted to study medicine. And in the course of my undergraduate studies, just started to realize that health was so much more than surgeries and medicine. And I started to get interested in the bigger picture of what actually influences our health. And by chance, at our university, there was like a health fair, and there was actually information about a school in California. It was like an acupuncture school. And I was like, oh, that looks really interesting. And so that got me interested in more of a holistic type of approach. And then that's where I happened to stumble upon naturopathic medicine. I kind of laugh now at how not naive, but like how little I knew when I signed up to go to naturopathic school. I had never seen a naturopathic doctor. I didn't actually really know what the heck we did. I forked over a lot of money and just was like, this sounds good. And fortunately, it was amazing and I love it. And I can't imagine doing anything else. But yeah, it was initially, it was the philosophy of being a more holistic approach that I was really interested in.
And I
Going
think
back
that
to our previous conversation about the differences and scoping out a very qualified naturopathic doctor, do you have access to like a website that we could add to show notes that someone could pop in, whether they're in Canada or the United States, to search their doctor to see if they are actually qualified?
There wouldn't be one website that I'm aware of, but if you went and Googled naturopathic doctor in your state or province, one of the first hits you should see would be like the Ontario Association of Naturopathic Doctors, or you can look at the Canadian Association of Naturopathic Doctors. In the US, it's the we're very creative with our names, American Association of actually Naturopathic Physicians, because they're allowed to call themselves physicians. So those would be more of the like countrywide databases where you could look people up.
And I think one of the frustrations that we often have that gives us a need for people like yourself is that when we just the tools that you mentioned, when we go to the doctor, they can help us if we need medication, they can help us if we have a specific disease, they can help us if we need to have a surgery. But what if it's just kind of one of those things where we have all these problems, symptoms, but we're not really sure that we, what to do or where to go. And we don't have, I think one of the big frustrations I know here in the States that I hear from my clients and from people all the time is that they go into the doctor and they just don't feel like they have a lot of time with their physicians to talk about all the different things that are going on. Like you said, a lot of times they just want to talk about one thing. And so, one thing that I hear clients really appreciate from any type of practitioner is someone who will listen. And I'm sure that that's where you really feel a huge gap is that you're taking that time with your patients, listening and digging maybe deeper than what they're going to get from that conventional route. Does that play
Yeah,
out?
that's it. It's a huge part of it. And I think, especially for women who we have historically not always been listened to, we have not historically always been believed when we are going in with different concerns. I think there's something very therapeutic and healing of just having someone who believes you, who isn't going to tell you this is all in your head,
Absolutely.
and who is willing to dig below the surface to help you understand what's going on. And I think that's one of the things I love most about my job, and also one of the things that my patients love about working with me is that they know I'm not going to dismiss them, and they know I'm not going to not believe what they're describing as their experience.
And you're going to take that time with them to
Mhm.
listen. And I think that is part of the, and I'm sure in, I don't know, in the naturopath world or school or training, I would think that that's a big part of what you all do is that that personal piece is a way of practicing, helping your patients.
Yeah, that's a huge part of it, is really helping to give individualized care and treating each person for what they are and what they're coming in for. So it's not as medicine, and again, I'm not bashing medicine, but medicine is often very formulaic, right? It's literally a flow chart. Do you have this? Yes or no? Okay, we go down here. Do you have this? Yes or no? And whatever answer we get to at the bottom, that's your diagnosis. And then we have usually a medication or a surgery that matches that. And for some conditions, that works extremely well. But as you're saying, if you have a condition that there's actually, you haven't really been diagnosed with anything, we're not really sure what's going on, sometimes that's where the art of medicine, right? We always talk about the science of medicine. Yes, there's a big science part to it, but I think any doctor who's been in practice long enough will tell you that the art is what gets the results a lot of the time. And that comes from listening, it comes from experience, it comes from trial and error. It often comes to, and this is something that I think we don't talk a lot about in medicine, intuition and like gut feelings, where you're like, I just have a feeling that this is something I want to explore. And a lot of times those feelings are right.
So, having said that, I totally appreciate what you're saying, but I also have issue with those practitioners that might not be as medically trained, such as yourself. And so I think there's a gap there. And so I think
Mhm.
it's important for people to find the right ear because the person could be a fantastic listener, but not be practicing evidence-based medicine or naturopathy. So can you address that?
Yeah, absolutely. And I think it's important to again, I practice evidence-based medicine as much as I can. So I do a lot of continuing education. I'm constantly learning and staying up to date so that my practice can be as current and up to date and evidence-based as possible. And I do think that that is incredibly important. And sadly, I was in the last few years, I have had to unlearn a lot of things that I was taught in naturopathic school that were not evidence-based, that I actually think are harmful, especially when it comes to restrictive diets, elimination diets, all these things that were just part of what we were taught to do that in hindsight, I'm like, these are deeply problematic. So I definitely think it's important to work with someone who's evidence-based. And I also think that it would be, what's the word I'm looking for? Like a bit naive of us to assume that we understand everything on a scientific level. I think it's a both and.
Mm.
There's so much we know from science. I love science. I'm a nerd at heart. I love learning and reading and learning about research, and that is great. And I also believe that there are certain things that impact us that we will probably never be able to measure and capture in a scientific study. So I like to kind of hang out in both. I would certainly potentially be concerned if your main medical advice is coming from someone who only uses energy or only uses intuition or isn't using any type of assessment. Like I send all my patients for blood work. I'm constantly telling my patients, please go get your mammogram, please go get your blood test, please go get your DEXA scans. And again, when you are listening with your full body, you're going to pick up on subtle things that people might not be directly articulating or that I can't measure in a blood test. But I think that information is also helpful.
What about lifestyle? How does that play into the work that you do with your patients?
It plays a lot into. Um, it's funny because I think sometimes patients come in and they expect that I'm gonna like give them a few supplements and send them out the door. And when I start to ask certain questions, you just see they're like, "Oh, this is more than I was expecting." But we cannot underestimate how powerful our lifestyle is. I mean, the both of you know how important our physical, like our exercise, our movement, like our physical bodies are so important. And most of us sadly aren't meeting even the most basic exercise requirements, right? So that's part of it. Another huge part of it, and especially for a lot of women who are in our 40s and 50s and beyond, I'm asking very pointed question about relationships. Because if you live with someone that you don't really like, or the main emotion that you feel when you come home is resentment and anger, that is going to be something we need to address. There's no supplement in the world that's going to fix your unhappy marriage, right? So,
True story. Yeah.
true story.
Yeah.
So there's so many layers to it, and how I tend to approach it is I meet most people where they're at, which is they're coming in for the physical stuff. So yes, I'm going to check your vitamins, I'm going to check your thyroid and your blood sugar and your cholesterol. I want to make sure that your body has those key functions that you need to feel good. But if we think that that's the layer we're going to stop at, I like to go next layer, which is looking at the mental and emotional piece. Because in my experience, both with my own health and working with lots of women at this point, when we start to look at some of those layers, that's where the magic really starts to happen. But it's also really hard to have the energy and capacity to look at that if you're not sleeping and you're super iron deficient. So that's what I love about what I get to do. I kind of get to do both of those pieces because to me, they're both equally important.
And with your
Amazing.
clients, and you're looking at lifestyle, you're looking at their relationships, you're looking at, I'm assuming you're looking at what are they ingesting, what are they eating, and you talked about the exercise piece. And you mentioned sleep. So just when we talk about lifestyle, is there anything else, like what all fits under that umbrella beside anything else that I'm leaving out there?
Stress is a big one
Mm,
that we leave
yeah.
out there, and relationships. I think, and especially through the pandemic, a lot of us have either lost relationships, dropped relationships, or just gotten way too comfortable being home. Some people have just not really reemerged into the world, and that's something I also screen for. What are your friendships like? How often are you seeing your friends? We know That is one of the key factors that determines people's health, especially as we get older. We know that having strong social connections is as important as whether or not you smoke cigarettes or drink alcohol. Like, it's a major risk factor. So that's another big thing. Stress and relationships. And stress is so interesting to me because most women completely underestimate the level of stress they are under. We
Hmm.
are so used to carrying a heavy load, and we are so good at just pushing through and surviving and rationalizing that it's normal. So if I ask most women, like, tell me about your stress, they'll be like, oh, yeah, like, I have some stress, but it's not a big deal. And meanwhile, pretty much every symptom that they're telling me about is worsened by stress. So mentally, we've like created this little game where we convince ourselves that we're not stressed. And meanwhile, our bodies are screaming for help because they are highly, highly stressed out.
So, you are the fatigue fixer. So,
I try to be.
yes. And so, women are tired.
Mhm.
And I'm sure that what you're just speaking about is, the stress, the relationships, and everything is spiraling along with maybe low estrogen or low iron or lack of sleep, all of these things.
Yeah. So it's important to know and to think about when you're trying to fix your fatigue. It's very rare that we're going to find one simple thing and be like, oh, we just fixed this and you're magically better. So, part of the work that I do, there's kind of 5 areas that I work on physically. The first one are nutrient deficiencies. These are incredibly common. This is your low iron, low B12, low vitamin D. I'm also always screening for thyroid function. We know that women are at much higher risk for thyroid dysfunction. And anytime there's a major hormonal change, whether it's puberty, pregnancy, postpartum, or perimenopause, there is an increased risk of developing thyroid issues. I'm also looking at metabolic function. That's where I check for insulin resistance, cortisol, or not cortisol, cholesterol, and inflammation. I'm looking at stress, and I'm looking at sleep. So those are kind of my 5 core areas that we're looking at to see which one of these is draining your energy the most, because there's also different types of fatigue. The type of
Mm.
fatigue where you could literally have a nap every afternoon is different than the fatigue that you might experience if you have a very busy, demanding job where you're feeling mentally tired, right? Mentally tired is like, I can't think. Please don't ask me to make a decision. Do not ask me what's for dinner. I can't make another decision. That's mental fatigue. Some women have more emotional fatigue where maybe they're caregiving, they have young children, or they're in a caretaking job like nursing or teaching. They are giving so much emotional energy every day that they are emotionally drained at the end of the day. They have nothing left to give. And then a lot of women are more what I call like spiritually tired. They feel burnt out. They go to work and they're like, what is the point of all of this? Why am I doing this? They're not connected to anything kind of bigger than themselves. They don't really know what the heck their purpose is. So, part of my job is to see what type of fatigue do you have, because depending on the type of fatigue you have, we're going to look at different types of treatments or lifestyle things. Because if you're spiritually tired, going to bed earlier is not going to be the thing you need. You need connection with people. You need to figure out what your purpose is. Maybe you need to volunteer and do something that is aligned with your values. So it really is a holistic look. And then that's also just looking on the individual level. I love also looking at all the societal stuff that is making us tired. I'm talking about unrealistic diet culture expectations. I'm talking about somehow we have to look like we're never aging a day in our lives. We have to be the perfect mom, wife, boss, look great in a bikini, be the bake sale. Like, the expectations on modern women are untenable. They are
Yes, it's
just, no matter
impossible.
It is impossible,
Mhm.
but yet we have been sold this idea that this is the dream, that we can have it all. And I'm a huge feminist and I want women to have choice. But the problem with we can have it all is we have internalized that as we have to do it all. And that does not work. You cannot do it all. You are going to run out of steam. And then the saddest part is that most women assume that the problem is them. Well, there must be something wrong with me because I can't do it all. I'm like, it's not you. It's the the lie. It's the
Mhm.
system that we were sold that we were supposed to thrive in that no one is thriving in.
What do you see, especially in the last few years, that you're seeing more of as far as the type of stress that the patients that come to you are dealing with? Do you see any trends?
That's a great question. So, definitely a lot of caregiving stress. So, especially when I'm treating women, maybe in their like later 40s, sometimes they're that sandwich generation where they still have younger kids and now they're caring for an ailing or elderly parent. I think honestly, the most common stress is like this superwoman syndrome, which I am a recovering member of. Like, I was your classic super high achieving student, got straight A's, captain of the volleyball team, student council. Like, I did all the things. And so many of the women that I work with were so good at doing. We're really good at getting stuff done and accomplishing. And those are amazing skills to have. But when you take those skills and you apply it again in this system that expects you to do all the things, it is a recipe for burnout. And we are seeing more and more burnout, which a lot of women don't even realize they're burnt out. Like, if they're still able to go to work, they assume, well, I can't be burnt out, right? When you can be burnt out and still be going to work every day. So I'm seeing a lot more burnout and I'm seeing a lot more depression. And depression is tricky because depression can look a lot like fatigue. That's one of the key symptoms. But that's something that I've been seeing a lot more, even in the last couple months, of women who are like deeply depressed. And I think there's multiple parts to that. But part of it is this like overgiving, overachieving, often taking care of others at the expense of taking care of ourselves. And when we do that over years and decades, it's going to catch up with us.
Yeah, and it usually will. Women only start to listen when their physical falls apart, when they can't sleep, when they're gaining weight, when they have no energy, and then they just want to do more. I will start running. Let me get on the Peloton. I'm going to cut my calories.
Yeah.
And
Yeah. I
how
see
how
this.
tough when you go to your doctor who is looking at surgery or medications for disease and you come with these problems and then we get frustrated that they can't solve those problems. So, yeah.
Yeah, it's like, again, I wish there was a super simple solution for women, but for most of us there isn't, because it really requires, and this is something I teach. So I run a membership called Effortless Energy, and I called it effortless, not because there's no effort, because most of us, the hardest thing for the women I know to do is to do less. That is the
Mm,
scariest, most
yeah.
painful part for most high achieving women, is like you
Yeah.
just said, no, I'm going to add, I'm going to run, I'm going to Pilates, I'm going to meditate, no, no, no. And I always use the example of a plate. If you were to take a metaphorical plate and put all the things that you do in a day on that plate, and now you're going to try to add meditation or exercise, that is going to slide off the plate so quickly because your plate is already full. So before you start adding to your plate, I want you to look at your plate and I want you to clear stuff off the plate, because so many things we have on our plate are based on other people's desires or other people's expectations. We're often doing things because we think we should, or because that's what our mom did, or our sister, or our neighbor. And we rarely take the time to look at our plate and be like, do I even want this on my plate? And then meanwhile, we're all miserable because the stuff we want, there's no room for it on the plate.
Mm, wow.
So, doing an inventory of, I call it like an energy audit, look at how you're spending your day and your energy. And does it align with what truly matters to you? If I ask my patients what matters to them, they're going to say their health and probably their family. If I were to follow that woman around for 48 hours, I wouldn't know that. And it's not a judgment on her, but we do not act in alignment with what we say is important. And that is very energetically draining. And it's also why so many of us are unwell, because we are prioritizing things that are important to other people and not necessarily what is important to us.
It's so interesting how you suggest to women to do less, and that's so freaky. It's the same principle as when you ask them to eat a bit more.
Oh
Like,
God, yeah.
you know, if
Panic.
if
Panic.
they're coming to you for weight loss and you're suggesting, well, you know, you need to eat a little bit more and make suggestions on that. Like, no, heavens no, I will eat less. I will go harder. I will work harder. Like, women are such workhorses.
Yeah.
And so I can totally see what you're talking about energetically as well. Because women are quick to add to their calendar, but do you think they'll take something off?
No, they never will. Yeah. And we didn't even really get into this, but the amount of energy that most women spend trying to shrink their bodies.
Yes, yes. Can
And
we get into that? Because that's a big
yes,
deal for our
it
audience.
is a big deal. So this is something that I have become really passionate about, because what drives me, like the reason I want women to have more energy is that I believe that we need more female leadership in this world. We need women showing up in their families. We need women showing up in our communities and our workplaces and in our government and everywhere in between. And a big part, there's many reasons why we struggle with that, but one big part is many of us are exhausted. And another part of that is many of us do not want to be seen because we don't like the appearance, we don't like the weight, we don't like the wrinkles, we don't like whatever it is. So the amount of women who are holding themselves back, who are directing our precious time and energy looking at the scale and counting calories and obsessed by a 2-pound weight gain, all I can think about is imagine we took all of the energy that women are putting into diet culture, the money, the time, the energy. Imagine how we could deploy that differently. Like, I can only imagine what we could accomplish if we took that energy and put it anywhere else.
Yeah, and that's just the time we're spending in our heads that even maybe the people around us, closest to us, don't even realize all these conversations are going on, and we're spending hours that adds up to weeks, that adds up to years in our heads, being obsessed with our appearance, our weight, and it's not time we're spending at doing all the things that we
And
could.
it's not to discount the need for health, because
Of course.
the energy put into increasing your health goals is much different than what the scale says. They're two different things. And if we could just separate those and just focus on the positive things we can do to improve our health, our weight would more likely fall into place.
Yeah. And we also need to stop so tightly connecting weight and health. Right? We assume that any weight gain is bad and that all weight loss is good. And that couldn't be further from the truth. And I couldn't agree more. I tell every patient, please go for walks, please start strength training, eat protein, eat vegetables, like eat real food. But I actually don't really care what it does to the scale, because I know that those activities, independently of whether they change the scale, they are changing your health.
Yeah.
But we've been so brainwashed that if the scale doesn't move, or if it moves in the so-called wrong direction, then we must be doing something wrong, or that those habits are bad. And that's a huge problem.
And we'll spend, from what I see, we spend a lot of time and energy on those thoughts and those worries and those frustrations that we could be putting to working on. And then we say we don't have time to get protein in. We don't have time to eat real food. We don't have time to eat. But the time that we spend on I'll have to, on our phones, I see
Oh my
this with,
gosh.
the time that we spend on, of course, social media, which I know, we're all on social media, but the time that we spend there, and then the time that we spend in our heads with all the reasons why we're not worthy, why we're not beautiful, why we're not where we need to be. It's time wasted, and time that is keeping us from doing these things that would actually make a difference, like eating more protein, like getting in our veggies and eating real food and prepping our food. So yeah, how do we do better as gals?
Yeah. So I just want to pick up on your point about how women live in our heads. So I've done a whole training on overthinking because it's very common. And it's actually a very common cause of mental fatigue that our brains never turn off. So many women, I'm sure, will be able to relate to this. You get to the end of the day, you're exhausted. You lie down in bed because you're like, I'm so tired. But then your brain is like, no, 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 I'm not done. I'm going to just keep going, right? So overthinking is exhausting, and it often interferes with our sleep, which makes us even more tired. The other thing I find so sad about how in our heads we are is that most of us are actually not present in our lives. So we might be physically with our children or physically with our spouse, but we're not really there. Even women could be having sex with their spouse and they're not actually there. We're constantly in our head. And a
Mm-hmm.
huge part of why I think that that's an issue goes back to what we were saying earlier, that most women don't notice the signs of stress in their body until it's like a triple red alarm. And part of that is because we're not in our bodies, we're in our heads. And when you're in your head, it's very easy to miss those subtle signs and signals that your body is sending you all the time, which is trying to guide you. And going back to this idea of intuition, intuition isn't just like, woo, I'm going to, I had an idea. Intuition is the stomach ache you get when you walk into a room with someone who's not good for you. Right? Intuition is that you feel exhausted after you hang out with your mother or whoever it is because she's emotionally draining. Intuition is all the different little pieces of feedback that we get either through emotions or through physical sensations. That is this like deeply wired historical thing that we had that allowed humans to survive. And especially women, because we are often more at risk of being in physical danger, we have a very highly attuned intuition. And when we start to get out of our heads and just take a moment to check into our body, there's such helpful information there. And the sooner we can start to actually listen and take action on whatever that's telling us, again, that is where, in my experience, real transformation happens.
And it's so hard because I tell clients this, listen to your body. But if we don't know how,
That's right.
we don't know how to listen to our body. Like how does someone start doing that? Where do they start?
You start with something that's going to sound so ridiculous, which is when you get the urge to pee, you don't write 3 more emails and then you go pee right away. When you feel thirsty, you don't wait an hour and a half to go get a glass of water. You go and you get a glass of water.
Mm,
We do not, most women, I'm generalizing,
sure.
most women ignore our most basic urges, like I'm thirsty, I need to pee, I'm tired, maybe I should go to bed. And then we wonder why we miss some of these other signals, but we have not cultivated that relationship where we're telling our body, I hear you, number one. And number two, I'm going to respond and give you what you need.
Yeah. And hunger cues as well,
Oh,
because
yeah.
we eat when we're not hungry. We don't eat when we are hungry. And then
Yeah.
women in particular have no clue as to, should I be eating? Am I full? Am I even hungry?
Yep.
We just suppress those feelings. And so then it's so hard to know what to do.
Yeah. And going back to stress, this is something I bring up with all my patients is we don't realize how much of a stress it is to constantly obsess about what you're going to eat. And it's also a big stress when you're either under eating or going super long stretches without eating. There's a very strong connection between blood sugar and stress hormones. So when you're skipping your lunch or you're eating like crackers and hummus and calling that lunch, if you're a grown human woman, that is not lunch, you are going to cause blood sugar issues, which further adds stress to your system. So part of what I always remind my patients is that our brains need a constant stream of glucose, right? Sugar. And if you are not eating sufficiently, your brain is not getting that steady stream. That is a massive stress. And you better believe your brain is going to send a signal to release stress hormones, because if it doesn't know when your next meal or snack is coming, or you're doing super long periods of intermittent fasting and just completely ignoring your hunger signals, you're adding more stress. And as far as I know, most of the women I know are not looking for more stress. They're looking for less. So food is such a hidden source of stress in many ways.
Yes.
That's a good point.
If you had a wish for our listeners, Sarah, what would it be?
My wish would be that if you're feeling tired, to not just have that be your status quo. There's a study that I found when I was putting together one of my courses that women wait an average of 7 months to seek help when they're tired. And I posted it the other day. If your dog or your child was sick, would you ever wait 7 months to call a doctor? Never. So why are we treating ourselves like we're not as important as our dog? Make the call, find a practitioner. If you're not getting the answers you need or you're being dismissed, call somebody else. There are lots of us out there who want to help, who want to figure out what's going on, who want women to be thriving. And for me, that starts with you have to have enough energy to get through the day. Otherwise, everything feels more difficult. And again, we don't need our lives to feel more difficult. We deserve to have the energy to do the things we love and to hopefully show up fully in the world, right? Share your gifts, be present with the people you love, do the things that make you happy. I want you to have the energy for all of that.
And my wish would be to, as you had mentioned, check in with your body and honor those cues, creating an awareness and appreciation for hunger or sleep or having to pee, because women do not prioritize themselves. And so just checking in with as a start for those physical cues will lead to other wins, I think.
And my wish would be that we work on getting out of our heads, whether it's changing the conversation if we're going to be there, and then taking breaks from there and actually living the life that is happening right in front of us instead of missing out. Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.